Hello, and welcome back to the Medical Entrepreneur IV Chelation training series. I'm Adam Sewell, MD, and this is video A2, where we'll discuss the basics of heavy metal toxicity. If you haven't seen video A1 yet, I recommend watching it first to get an overview of this entire course. Let me start by reminding you of our disclaimer. All information provided in this training is for educational purposes only and does not replace independent clinical judgment, local regulations, or official guidelines. Always consult appropriate references and specialists when dealing with potential heavy metal toxicity. When we talk about heavy metals, we're referring to metallic elements that, at certain doses, can pose a toxic risk to humans. These metals can accumulate in different organs, often leading to a wide range of adverse health effects. Today, we'll focus on the 5 most commonly encountered ones in medical practice. 1. Lead Pb, 2. Mercury Hg, 3. Arsenic As, 4. Iron Fe, 5. Copper Cu. Now let's go through why these metals are so significant, how people might be exposed, and what signs or symptoms clinicians should watch out for. 1. Lead Pb. Common sources: lead-based paints in older homes, contaminated soil or water, certain occupations like battery manufacturing. Health impact: neurological effects, especially in children, such as cognitive impairment and behavioral changes. Adults may experience headaches, abdominal pain, and kidney problems. Toxicity: note, chronic exposure is often more insidious, with symptoms developing slowly over time. 2. Mercury Hg. Common sources: fish high in methylmercury, for example, swordfish, king mackerel, industrial emissions, and broken fluorescent lamps. Health impact: neurological symptoms like tremors, memory issues, mood swings. Renal damage can also occur. Toxicity: note, organic mercury, methylmercury, tends to target the nervous system, whereas inorganic mercury can affect kidneys more prominently. 3. Arsenic As. Common sources: contaminated groundwater in certain regions, pesticides, and industrial processes. Health impact: acute poisoning presents with severe gastrointestinal distress, dehydration, and cardiac issues. Chronic exposure can lead to skin lesions, neuropathy, and an increased risk of certain cancers. Toxicity: note, arsenic toxicity can be life-threatening if not identified and treated quickly. 4. Iron Fe. Common sources: overdose of iron supplements, multiple blood transfusions, leading to iron overload. Health impact: acute iron poisoning can cause severe abdominal pain, vomiting, and metabolic acidosis. Chronic overload damages organs like the liver and heart. Toxicity: note, deferoxamine is a well-known chelating agent specifically used for iron toxicity. 5. Copper Cu. Common sources: excessive copper in drinking water from corroded pipes. Wilson's disease is a genetic condition causing copper accumulation. Health impact can cause liver disease and neurological symptoms, tremors, psychiatric disturbances. Toxicity: note, penicillamine or trientine are sometimes used to manage copper overload conditions like Wilson's disease. So those are our primary culprits. Next, let's discuss the difference between acute and chronic exposures, because timing and dosage play huge roles in the clinical presentation. Acute exposure: high doses over a short time, often more dramatic and life-threatening, with severe symptoms that appear quickly. Treatment is usually urgent, often involving IV chelation to prevent permanent organ damage. Chronic exposure: lower doses over extended periods, symptoms can be subtle and progress slowly. Common in occupational settings, older housing, or dietary sources. Now, how do we confirm heavy metal toxicity? This brings us to the importance of accurate diagnosis and lab testing. Blood and urine tests: blood lead level, BLL for lead, urinary mercury for mercury, 24-hour urine arsenic for suspected arsenic exposure. Clinical correlation: lab values should be interpreted alongside clinical history and symptoms. Specialty tests: in some cases, hair or nail samples might be used, although their reliability can vary. Organ function monitoring: check kidney, liver, and cardiac function where relevant. Having a solid diagnosis is crucial before jumping into IV chelation therapy, because each chelating agent works best on specific metals and can have its own set of risks and side effects. We'll talk more about the drugs themselves in video A3, so be sure to stay tuned for that. Let's recap the key takeaways from this video. 1. Heavy metals and their sources. Lead, mercury, arsenic, iron, and copper are among the most clinically significant. 2. Acute versus chronic exposure. High dose, short-term versus low dose, long-term. 3. Symptoms vary by metal, neurotoxicity, GI issues, renal damage, and more. 4. Accurate diagnosis, blood, urine, and organ function tests guide treatment decisions. Thanks for watching Video A2, Basics of Heavy Metal Toxicity. In our next video, Video A3, we'll dive deeper into the major chelating agents, how they work, when to use them, and which metals they target most effectively. If you have any questions, feel free to drop them in the comments or discussion forum, and I'll do my best to address them. Remember, this course is all about blending clinical evidence with entrepreneurial insight so you can deliver safe and effective IV chelation services within a thriving medical practice. I'm Adam Sewell, MD, and I'll see you in Video A3.